In this episode,
this study from the 1940s
yes,
is what physicians used for decades to tell men that testosterone therapy was dangerous and could cause prostate cancer.
there you go.
You're maybe noting changes. And in the past, we used to call this the midlife crisis.
Correct.
So men would go out and get a Lamborghini and a new
That's
girlfriend, right?
A red one.
As we see these chemicals and everything else coming in affecting men's hormones at the same time, we're seeing so much mental and emotional garbage that's telling our society that men don't have value.
Right.
And I think we need to be very careful about that.
Hello and welcome to Health in Focus. My name is Jacobus Hollewijn. I'm your host. Today we are talking with Dr. Hilary Lampers, a naturopathic physician. She's working here in the Bozeman area. We had her on before talking about neurocranial restructuring. We hope you check out that video as well. But today we're talking about men's health. Interesting thing is that naturopathic physicians often wear many hats. They work with the spirit, the mind, the body, and they are addressing different topics depending on what their patients need. Now, even within the naturopathic physicians, there are certain favorable topics that doctors like to work with, where with most doctors, unless you're a general practitioner, you are usually a specialist. Now, Dr. Hilary she loves to work with menopausal women. She likes to work men's health. She does the neurocranial, but she works with all kinds of topics. So today we are discussing a little bit, touching the veil, lifting the veil on men's health. Dr. Hilary, welcome to the program.
Thanks for having me again.
Welcome back.
Jacobus. Thank you.
Yeah, you bet. So men's health.
Yeah.
I recall that in the previous show you mentioned, this is why I got into men's health. What was that?
So it's kind of a funny story in a way. I'd been practicing medicine. I've been practicing since 2007 and mainly specializing in the neurocranial restructuring. And with that segment of patients, I saw a lot of men. And that's mainly because men tend to have more head traumas. They have higher incidence of concussion and TBI, usually related to sports, related to military service, and they do more high-risk activities like car accidents and fighting and hits to the face and that kind of thing. And so I was working with quite a few men in that arena, working structurally with them and other providers that they had to support them there. And what you'll find in a lot of these men, especially men that have had chronic concussions and head traumas, is that they have not only the structural issues, but there's lots of other complications that come along with that, the neurological stuff. But we also see a lot of hormone dysfunction. And like in the last video, we talked about the pituitary gland sitting on the sphenoid bone and how the manipulation might support hormone function. What I would see in my practice is I would see some of these men coming in and they would be having lots of symptoms that would be related to, let's say, hormone deficiency. And at that time, because I was mainly specializing, I wasn't really treating them for that, but I would see these effects going on. And so I'd be working with their other doctors and whatnot, and they might have a hormone deficiency like testosterone deficiency, etc. And so they were being treated for that as well. And that really got me sort of interested in the whole hormonal dynamic of head trauma. And then, funny enough, I'm married to a man, and we, at the time, we've been married for almost 30 years, and so we've been together a long time. Amazing. And in 2016, we decided to start a podcast together. Besides my medical training and stuff, my husband has worked in the fishing industry. He worked in the outdoor industry. He's a big archery bow hunter, so he spends a lot of time in the mountains. He spends over 100 days a year in the mountains. Wow. And he's very tuned in to nature and stuff. And he's also a lot about sustainable living, procuring your own meat and your own food. And so at that time we had a big garden in Washington, and we'd lived in this place for 20 years. We'd cultivated the soil, and we just had a real relationship with our food.
Yeah.
And we had decided, like, let's start a podcast. And we're at that time, kind of the homesteading movement was sort of getting its footing. Like, a lot of people were talking, they were leaving their jobs in the city and buying some farmland, and they were farming it and growing their own food and doing animal husbandry or learning to hunt and to do this stuff. So it was kind of a good time for us to come in, and we started a podcast called Hunt, Harvest, Health. And
Hunt, Harvest, Health.
And it just incorporated what my husband loves to do. It incorporated naturopathic medicine, which in that arena really was sort of not even heard of that much. And then we talked about, again, food, soil, conservation, all these things. And really it was meant to be a hobby. But in that world, in the outdoor, and especially in the hunting world, it's mainly men. The big demographic is men, and about 80% of our listeners were men. And so when we started realizing that, I was coming up with health topics that we could talk to these guys about, and obviously men's health would be there. So started talking a lot about testosterone, started talking about other hormones related to men's health, started talking about the estrogens in our environment and all the toxins within our food and within our water supply and all the things that you and I know about in our food supply. And we were just educating people in our community about that. And slowly, as we had that podcast, and then we created a website called Stealthy Hunter, and it was an educational platform where we were putting recipes and writing blogs. We were sharing our garden and putting our podcasts on there. It was just purely educational. More and more men started tuning in. And so I kind of, by not meaning to, a lot of men started consulting with me.
Yeah.
And so I started doing more training and learning more about actual, like, hormones, interactions, men's health, more towards that. And I mean, I'd learned a lot of stuff in school, but again, I was really specialized. And so I wasn't seeing patients for that.
Right.
And then we moved back to Bozeman in 2018, and I really needed to just work and kind of work as much as I could because my husband was going to leave his job, and the podcast allowed us, and Stealthy Hunter allowed us to leave Washington and come here and have my husband quit his job, and we put everything into that full time. And then I went into full-time medical practice. And because of the demographic and because people listen to the podcast and because it's Montana, so we've got a lot of these type of people. We got a lot of hunters.
Right. Yeah.
They started coming to me for healthcare, and I was really lucky because I just started seeing a large demographic of men.
Yeah.
And typically the average man that I'm going to see in my office is probably going to be between 35 and 65.
All right.
And, coming in and seeing me. And so through the last few years, that's how I got into men's health. It was just kind of vicariously by talking to this group of people, to men in general, and then having them trust me. It's much like this show, it's much like your business. People come in, they talk to you because they trust you. If they watch this show, they feel like they know you.
Right.
Even though you've never met them.
Correct.
And then they come in and they talk to you. And so that's what started happening with my practice. And honestly, I just really enjoy working with men. One, because, I hate to say this, but men are hormonally much easier than women.
Yeah.
And I know in the future we may talk about menopause.
No pun
and these other
intended,
things.
but we only have an on-off switch.
Yes.
It's real simple.
Yes. And men are also, just the way that your brain works and the way you consume information, men are just kind of easier once they see data and stuff to do what you tell them and to get the support. One of the drawbacks of men in general is that you guys aren't really trained to listen to your body the way women are. And I think that is just women have so many hormonal life cycles with puberty, pregnancy, breastfeeding, perimenopause, menopause, postmenopause. These are all very different hormonal stages. And women really in that cycle every month, they just have so much going on that we have to tune in a lot. So men are much easier. You run on a 24-hour hormonal cycle. Cycling women are running on a 28-day hormonal cycle.
Okay.
And so it's very different, right? And you kind of like go to bed at night and regenerate your hormones, and you wake up in the morning and you're ready to go, and then you have your day, and then you just do it all over again.
That's right. It's true.
Right? Whereas women don't do that, and there's lots of changes that can happen. So I enjoy working with men because you can actually, if the patient actually works and does what you recommend, or is creating those lifestyle choices that you've educated them in, you can see pretty rapid change because of just the
application.
Just because of the ease of the way your hormonal cycle is set up compared to a woman. Whereas a woman, this treatment may work in the first 2 weeks of her cycle, but it may not work in the other 2 weeks, right? Because estrogen and progesterone switch, they flip, and it changes just even the way it is. And so it's much more complicated. So I've enjoyed working with men that way. The other thing is that I've realized working with men, unfortunately, men usually wait too long. Men spend most of the acute healthcare dollar. Women spend most of the chronic healthcare dollar.
Interesting.
Meaning women go to the doctor more. They take their kids to the doctor. It's very rare that men are taking their children to the doctor on a regular basis, right? It's mainly women. Women, because of this crazy hormonal cycles that we have throughout our life, they go to the physicians more. If they've got a problem, they're maybe going to go to the physician more. Men tend to not do that. They tend to compartmentalize how they feel. I would even say some men, they disattach from how they feel, whether this is a learned behavior or it's just the way that the brain is working to keep them going. And so sometimes you'll see men coming in and they've been having problems for a long time, and they just haven't reached out for help sooner.
Or they figured out they can probably pop a pill and just be done with it.
Or they end up in the ER, or they end up thinking they're having a heart attack, or they do have a heart attack, right? And so I've realized too that men's healthcare in general, I feel it's very poor. And I think our training of men and the trust. So men need to have trust. They don't trust doctors.
I see.
I don't know where this came from, but men typically, what I will hear from a male patient, like, well, why haven't you seen anybody before now? They'll typically say, like, I just don't trust doctors. And I don't know where that comes from, but I think it could be because maybe they've had experiences with their father, their grandfather, their brother, whatever, like had a massive heart attack and ended up in the hospital and they couldn't save him or whatever. You know, you just don't know. But men have this, like, also I think men's program is like, there's just pain in life and you just deal with it, right? Like if you have to get up every day,
it'll fix.
Yeah, it'll fix. And in a lot of cases it does. I mean, I'm a huge advocate of not running to the doctor for every little thing. Really, you shouldn't be doing that. You should be looking at your lifestyle, being like, oh, I think maybe my diet could be, you know, like there's education that needs to come in, but I think it's good not to run to the doctor for everything, right? And your body is the most innately created machine in the universe. It is literally designed to do the things it needs to do to heal you, right? You don't need a doctor to tell you to heal yourself. Again, back to docere and teachers, like we're there to teach, we're there to facilitate. And I tell my patients that all the time. I am not doing anything for you. Like I'm not doing your treatment plan. I am facilitating what I think could help you. You have to do all the work.
If you already give people an explanation about what may be happening in their body and then give them a strategy, I realize it gives them hope. When they have hope, there is something already happening in the body that starts the healing process. I think people losing hope is often a reason why we get worse and worse. Let's see, people who are diagnosed with cancer, for example. We talk about men. Prostate cancer is a big one in men. maybe lung cancer, but then you go to a specialist who says you got 6 months to live. You're probably not going to make it till Christmas, maybe 3 months or 4 months to live. And I've sat down with people like that too, and they say, yeah, doctor said 6 months. I said, oh, good. And he said, what do you mean good? I said, we got 6 months. We have a lot of time to work on this. And they thought it's really, we're just going for the exit. You know, it will take 6 months to get to the exit. I said, no, we got 6 months to improve your health. It is, don't give up. And so I noticed that also in men, they're a little bit fatalistic in once they do get sick, that they think this is the big one, this is it. Women, because like you say, are more in tune with our body and are dealing with so many emotions and hormones and physical ailments that they want to check on regular checkups, they don't panic right away. It is, I noticed that. They say, well, there's probably something that we can do. Not everybody, but I notice it in women more. Men, when they get sick, they think that's the end of it. They have a very hard time dealing with that. And I think that one big misunderstanding with men is they just think they make testosterone, and that is the only hormone. And so when they have prostate cancer and a doctor says, well, we got to lower your testosterone, I go, if testosterone causes prostate cancer, every 25-year-old man in this country should have prostate cancer. It's not the 65 or 70-year-old, because we do know our hormones change as well, just like women. But I tell people, and men especially, you make the same hormone as the women, except the ratios are a little different. We make more DHEA and testosterone, where women make more estrogens and progesterone. But otherwise, we make all the same hormones.
Well, let's talk about that a little bit. I think this is also, again, if you're going to educate people, I have a chart that has the entire steroid hormone pathway in it, from cholesterol, which all these steroid hormones come from cholesterol. And I show it to my patients while I talk them through this, because men especially love data. Okay. A guy is going to look at data and he's going to be like, oh, I didn't know that. But if you show it to him, it's very helpful. So I show them like, okay, here's cholesterol. From cholesterol, you make pregnenolone. And then from pregnenolone, you make progesterone. And from progesterone, then you can go across to the adrenal and make DHEA. You go down and make cortisol and cortisone, which we can talk about, because that's a big factor in men as well. And then you go across to your androgens, which would be testosterone, DHT, androstenedione. There's another one I can never say.
Androstenediol. Androstenediol goes into testosterone, estradiol, and DHT. And androstenedione is...
Here's where men don't understand. Like, they're like, how do I have estrogen? So men and women both make all these hormones the exact same way. But women have an enzyme called the aromatase enzyme that in both the brain and peripheral tissues, especially fat tissue, it's made, and it converts your testosterone to estrogen. Okay. So women just have lots more aromatase, and we turn most of our testosterone into estrogen. Men don't have as much aromatase, and so they keep most of their testosterone, but they still make some estrogen. So if I were to run labs on you, you should have a specific testosterone to estrogen ratio, and that can differ based on the guy, right? That can be genetics. That could be body fat content. So the more adipose tissue you have, fat makes estrogen. And fat cells also make more aromatase. So the heavier you are with fat, the more aromatase you're going to make. So you're going to convert more to estrogen. And insulin resistance will do this as well. It creates more aromatase activity. And inflammation in the body will increase aromatase activity. So out of those things, tell me how many Americans don't have at least one of those? American men. Don't have at least one of those, okay? So that's a huge factor in how much estrogen you're going to make. But typically men are keeping most of their testosterone, and testosterone is their main sex hormone. So your testes make testosterone after your brain tells your testes, hey, we need to make testosterone. And then there's a feedback loop that goes back to the brain that says, got enough testosterone. And so there's this constant feedback loop going on between the brain and the testes. Excuse me. As men get older, they start losing the testosterone rate percentage starts going down. And they say it's about 1% every year after the age of 30. I would bet it's probably more than that these days because of our toxic estrogen
You bet.
excess environment. Okay. But that would be typically, and once you get to a certain age and your testosterone has lowered so much, we then call that andropause. So men they are slowly going down in testosterone over their lifetime, but they are not losing all their testosterone.
Right.
Your testes do not go to sleep. They continually you can father children into your 80s if you want to.
If you want to.
But
Show up at graduation when you're 100. You're
Yeah.
behind a walker.
I want to say I think the oldest guy that is like 92 or something.
Yeah.
I don't know. But so this slowly happens over your life, but andropause is kind of that middle age where you're maybe noting changes. And in the past, we used to call this the midlife crisis.
Correct.
So men would go out and get a Lamborghini and a new
That's
girlfriend, right?
A red one.
Because they were like, my hormones are going down and maybe I don't have as much energy and I don't have a libido and I'm not. So I just need to change my circumstances.
Yeah.
Like I need to get a hotter, younger girlfriend
But
and
I
need to get
have
a fast
the money.
car.
I have the money.
And now I have the resources. But the fast car and the younger girlfriend doesn't really change anything, right? It doesn't. And we know that. And so that andropause stage, most all men are going to go through that. But that's what testosterone does. And so you do have estrogen. You need estrogen. Estrogen is important for your brain.
You bet.
It's important for your bone mass.
Yes.
It's important for libido. It's also important for erections. So when a man has too low, it's also important for mood. So a man who has too low of estrogen is going to feel kind of melancholically depressed.
Interesting.
He's going to have sexual side effects, possibly. He's going to start losing bone mass. And the problem is you don't feel bone mass until it's too late.
Right.
Right? So again, we don't want men losing bone mass. And your brain has estrogen receptors, just like a woman's. So you need estrogen for your brain and cardiovascular health. So estrogen is important, but the ratio is important. Now, if we're going to talk about something like prostate cancer,
Right.
you don't want too much estrogen because estrogen receptors have been shown to implicate tumor growth.
Correct.
Okay. And you've got beta and alpha receptors. And they're, if we're going to dive deep into prostate cancer, they're looking at estrogen, different types of receptors. One is protective and one is not protective.
Sure.
And so again, prostate cancer is so common. Like most men die probably with some prostate cancer.
Even though they may not know it.
Right.
Yeah.
But what's really interesting is that the studies that came out on androgens and testosterone were done a long time ago. They were done in the 40s, and they were done by a physician who had been testing testosterone with different conditions and stuff. He actually won the Nobel Prize. I can't remember. I think the androgen receptor, he had something to do. I can't exactly remember what he won the Nobel Prize for.
Yeah.
But he did a study, wrote a paper on, there was one patient, an N of 1. I don't even know how this got through because this is not statistically significant at all. But there was an N of 1 of a man who had taken testosterone therapy and his prostate cancer got worse. Okay. So this study from the 1940s is what physicians used for decades to tell men that testosterone therapy was dangerous and could cause prostate cancer.
There you go.
But today in urology, in the modern medical world of men's health, we actually know that that prostate cancer is likely being caused by low testosterone.
And by elevated estradiol.
And by these elevated estrogens. So again, if you go back, excess body fat, insulin resistance, inflammation, which is going to drive aromatase activity.
That's right.
And now you have excess estrogen.
Yeah.
That is what's driving it. And so even sex hormone binding globulin, which is a protein that binds up most of your testosterone.
Correct.
Sex hormone binding globulin will be affected as well by that affects how much testosterone you bind up, etc. And they know that prostate cancer in general, what was I going to say? So, hold on a second. It had to do with testosterone and, and PSA.
PSA.
Sorry. So PSA is a blood marker.
Prostate-specific antigen.
Yes. And it's a blood marker now that we can actually test the inflammation of the prostate without doing a prostate exam.
Correct.
We know that stimulating the prostate too much can cause problems, right? And you have to feel a lot of prostates to actually know. So I'm not a urologist. I don't specialize just in men's health. I'm not doing prostate exams all day long. So if I have a man who comes in and his PSA is elevated, which would just say in the blood, he's got this antigen that's showing there's some sort of inflammation to the prostate, whether it's BPH or a cancer, I refer them to the urologist.
Okay.
And then the urologist is either going to do a prostate exam or they're going to do a biopsy. And they're going to see, like, is this cancer, is this BPH, whatnot.
Right.
But we know any stimulation to the prostate can increase PSA. We know riding a motorcycle, riding your bike every day to work, having sex, riding a horse, these can all increase PSA. So we have to be very careful with men when we do labs. I have to say, please do not have sex for 2 days before your prostate, your PSA test.
Okay.
Do not ride your motorcycle all weekend. If you ride horses, don't ride your horse for 2 days.
Right.
Because it stimulates the prostate and it could increase it. And then,
Then you
there's
get a
nothing
false- you get a
worse
false
than getting
number.
a guy that's got a PSA over 4 and now you have to send him to the urologist. And so we try to diminish those factors. But we do know that PSA will be falsely low when you have low testosterone. And this is a complication too. So you could get the guy's hormones back. It says testosterone's low, or it's in the normal range, but it's like normal low, let's say, and their PSA is low. So you go, oh, your prostate's great. But then let's say you do hormone therapy with them, and all of a sudden their PSA goes up. Now it may not go over 4, which would be medically indicative of needs to be checked out. But let's say it goes from 0.2 to like 2.5.
You bet. That's a big change.
And then you're like, oh, what's happening?
Yeah.
Well, that's normal because their testosterone was low, which was falsely elevating or lowering their PSA. So their PSA is maybe going to go up a little bit, and that's okay. But it should level out, and it should be good. Now, if you've got actual like PSA that's going up, or you give him testosterone therapy and you see him jump, this is why we run labs. This is why we keep track of the guy. Oh, okay, something's going on here and we need to have this checked out. So that's very interesting when it comes to prostate cancer. And I can tell you just from clinical experience in the last 6 years of seeing hundreds of men is like testosterone deficiency is becoming rampant.
Yeah.
And I see guys in their 20s that have lower testosterone. I've got some patients in their 70s and 80s who have higher testosterone.
Yeah.
So why would that be? Well, I think that's because the men today, or that have been born in the last 3 to 4 decades, in the last 2 decades for sure, they were exposed to high levels of toxins and estrogen-like substances in utero.
I would almost say 50 years. I think that since the invention of the pill in 1969 or so, that became used more often by women and prescribed by doctors, I think that's when we started noticing a change, because they realized what it did for women. So they started incorporating hormones, estrogen specific, with animal food. And so I tell people too, you take 50 years of treating animals, cows, pigs, even chickens, with hormones to get more yield out of them. These animals, we're talking tens of trillions of animals over the last 50 years in all over the Western, let's say the civilized world, wherever they've used them. These animals poop and pee wherever they stand until the day they die. And none of that gets cleaned up. It pretty much goes straight into the groundwater. So you add that up over 50 years. Then you look at the pill and all the hormones that women have been exposed to, women and makeup that women use, that many of them have estrogens in it to rejuvenate skin, etc. They wash it off their face, put it on, wash it off. They take the pill, they take other hormone preparations. they use the bathroom as well, and that goes into the groundwater, into the the filtering
Well,
system. But you add it up, you talk about tens of billions probably of women who have been using medications, tamoxifen when they have breast cancer or uterine cancer, and so a lot of that gets flushed out, and then whenever we take a shower or swim in the lake anymore or go in the ocean, the water has been affected by hormones. And I think therefore that, in my opinion, it started about 50 years ago, but it looks like it has intensified.
Yeah, and a lot of water facilities, they can't filter those drugs
They
out.
can't. No.
So when you take hormones of any kind, I mean, I prescribe hormones to women. I give them bioidentical estrogen. I give these. Now,
But
it's
you're
more the
watching
synthetic.
it. You're watching
yeah,
it with blood testing, and you see if it's
Yes.
working or not.
But if it's going into the water system, we're all being exposed to that.
Yes,
And so
that's
I do
right.
tell men, like, okay, there's a lot of estrogens in the environment that your body doesn't know what to do with, like a woman's body does. And at the same time, we're all suffering from that, both sexes. So again, having a good water filtration system, like thinking about these things in your home, even just in your direct home, keeping as much plastics out, like trying to do as much as you can in your immediate vicinity, especially if you live in the city where the city's controlling how your water's getting filtered. And, we live on a well. And so we definitely get stuff in the well. We know everything goes into the groundwater, but we don't get the exposure as much as someone who lives on city water.
Correct.
Because the water treatment facility plant is pulling the same water through, and it's coming into homes. But we still have filtration systems on our well.
Right.
We have an RO system that's filtering a lot of this stuff out. And then we have to, there's things you have to do, and you will have these exposures.
Well,
And
then you have the cell phones. A lot of men carry their cell phone in the front pocket.
yeah.
And I talked to one gentleman who was about 31, 32 years old, works out a lot, is a very handsome looking guy. And he came to me and he said, I cannot get an erection. I just got a brand new girlfriend. And not like brand new, I took off the shelf. But he had a girlfriend, and he said, I cannot get an erection. I said, well, where do you keep your phone? And he said, right here. I said, I know. I saw you coming in. So I know that. Put that phone away. How often do you really look at that phone? And he said, maybe 6, 7 times a day. I said, then look at it 6, 7 times a day, but put it away. And he did what I said. And a week later, no more problems.
Yeah.
And it was an 82-year-old man who came talk to me. And he said, I just got a new girlfriend. And she ended up being 79 years old.
Oh.
It was really cute.
Good
But he
to
said, I
understand
can't
little.
get an erection. And I said, I saw you coming in. You got your cell phone in your front pocket. I said, I'll take it out. And he actually walked out and put it in his car and came back in. It was really cute. But I saw him 2 weeks later and everything was working. So we also have the electronics that we're so exposed to, we cannot almost live without it
There's
anymore.
no long-term research on any of this.
No.
We are like guinea pigs
Yeah.
since post-war era, which would be World War II. Everything that's been created to make our lives easier has actually been very difficult on our long-term health, especially our hormones. Because remember, all hormones, especially steroid hormones, they're all lipophilic. They like fat. They're cholesterol molecules, so they're fat molecules.
Yeah.
And so all of these hormones, all of these xenoestrogens, all of these forever chemicals, all of the plastics, all of the fire
Herbicides,
retardants,
pesticides.
atrazine,
Yeah.
glyphosate, they are all lipophilic. They want to stick to fat. And so that's why they affect your sex hormones so much. And I remember talking about this 30 years ago in
No
my
way.
undergrad in nutrition.
Wow.
We talked about this in naturopathic medicine all the time. And what I'm seeing now is the conventional model. I'm seeing people come out from the conventional world talking now in the last decade about how this is horrible. Whereas 30 years ago, it was like, oh, those are just a bunch of tree huggers talking about stuff. And what we're actually seeing in the science now is that our hormones are going down. The hormones we need to feel good are going down, but the synthetic hormones and the xenohormones and the pesticides and herbicides are going up, and they're challenging our natural hormone system. So if we go back to birth control, I know this is a men's health thing, but men are highly influenced by birth control. Birth control it lowers your own natural hormones. Most women do not understand this. It's mimicking pregnancy is what it's doing. It's telling your body not to ovulate. And by doing that, you have to lower endogenous is what your body makes. You have to lower your endogenous estrogen, and you have to lower your endogenous progesterone. So when you take an estrogen, estradiol, progestin, birth control, it's lowering your own production, and that's how you don't ovulate. It's the same with testosterone therapy in men. When I give you testosterone, your brain's going to go, wow, there's a lot of hormone here, and the testy is going to slow down.
Correct.
And your endogenous testosterone is going to go down.
Yes.
So when you give someone hormones like this, there are changes that happen in your endogenous hormonal system that you have to understand. And for men, if you're being exposed to all these estrogens in your environment and your lifestyle sucks and you're doing this, you're going to just naturally, your hormone receptors are going to, be affected by those estrogens. And what does your body think when there's a bunch of estrogen in your body? It thinks there must be a lot of testosterone.
Right.
Because you're converting your testosterone to estrogen. So your own testosterone is likely going to go down. And this is where we see the receptors are getting filled, but by the wrong thing.
Yeah.
Okay. Now, I'm a big advocate of testosterone replacement therapy when it's indicated because it really can change a man's life.
Absolutely.
When he's in middle age and he's feeling horrible and he can't sleep through the night and he's gaining tons of visceral adiposity, he's, we talk a ton about sex drive with testosterone, but sex drive is only a small part of it. And this is where, if I go back to when I say I think men's health is really poorly done, it's because the interview that's done with men when they go to the conventional doctor is like, so do you still like to have sex? Now, most men, what are they going to say?
No, just kidding.
They don't say that. They say, yeah, but you don't dive deeper. Or they say, can you still get an erection? And the guy's like, yeah. Well, you don't need testosterone. We don't need to check your testosterone.
Correct.
You're missing 10 things. That's one thing on the bullet points. You're missing all the other factors. How's your brain fog? What's your fatigue like? Do you hit the chair at 4 p.m. and you're literally dysfunctional in the afternoon? Can you get out of bed with energy in the morning?
Right.
Are you sleeping all the way through the night? Are you having hot flashes? Are you having night sweats?
Do you get up at night to go to the bathroom?
Yeah. How many times a night are you peeing? Like, they don't ask all those questions because if you were to look at it and run their labs, you might see their testosterone is low. Now, the sexual side effect can be one of the last things to go. So this is where men's health sometimes, especially hormonal health, and we don't have baselines. So if you had been a patient of mine and 30 years ago they started running your testosterone in your yearly labs, and 20 years later you come and you're like having all these symptoms, I could look back at your previous labs and I could say, wow, you were this. I ran your labs. Now you're this.
Yes.
Okay, we've got a baseline here. We can see that your hormones have drastically gone down.
I agree.
But they don't run that. Why? Because of insurance, because insurance doesn't want to pay for it, when we could have the baseline to help a man feel better. And that is where so then the men just don't go to the doctor because they go in and they feel horrible and the doctor discredits them, doesn't help them. And then they're like, I'm not going back to that guy again.
No.
And then the next thing you know is they do end up in the ER or they do end up with a cardiovascular risk. Did you know that testosterone, not just estrogen, but testosterone is very important for your heart?
It's the number one hormone for the heart.
Exactly.
Because every muscle in your body needs testosterone in order to function, and the heart is the hardest working muscle in the body.
Yeah.
So if you don't have enough testosterone, there is a quick increased risk in strokes and heart attacks. As a matter of fact, there was a study done, published by Life Extension Foundation back in 2012. And I wrote an article about that, and it pretty much says that if a man's total testosterone production gets under, but he tested 2,400 men, between the ages of 69 and 81 years old. And they wanted to see why is it that as men get older, do they get Alzheimer's, do they get heart attacks, strokes, prostate cancer, obesity, diabetes, which are more diseases that happen as men get older. And they discovered that men who had low testosterone and elevated estradiol were much more at risk. And they said if you look at a blood test for men's testosterone, the reference range on the test is somewhere between 246 and 950. And then you look at those numbers, that's a big range. And so almost everybody falls in the range, but 246 is where you might expect an 80-year-old to be, and 950 or 1,000 is where you expect an 18-year-old or 20-year-old to be. So obviously everybody would like to be at the high end. And so what they discovered, according to those 5-year study on 2,400 men, is that the ideal number for men was anywhere between total testosterone 700 to 900. And they said, if the number gets less than 550, even by 1 point, 549, 548, 547, they said there is an immediate 30% increased risk for cardiovascular problems and heart attacks, and an immediate 24% increased risk for strokes, just by going under 550. And so then they start talking about, they did a test, they simultaneously tested men for the free testosterone, which I would like you to explain. And then they tested estradiol. And I tell men too, I think that 99% of men have never heard of the word estradiol. If you don't know the word, you don't walk in a doctor's office and say, can you check my estradiol while you're at it?
Well, a lot of doctors, they'll say, sure, I'll take your testosterone, but checking testosterone without estradiol is useless.
Yeah, because you need the ratios.
Yeah, it's the same with testing free total without free.
Yeah.
Free testosterone is what is available to your cell. That sex hormone binding globulin I mentioned earlier, that's a protein that you make that binds up most of your testosterone. So let's say you have a 500 testosterone and you have a 9 free. That means 491 of your testosterone is bound up and cannot be used, okay? So sex hormone binding globulin plays into that too. In men who overexercise, there's lots of chemicals that do it. There's genetic factors. Some people have genetically really high sex hormone binding globulin. So they could have a 700 testosterone and feel like crap because their free is like 10 or their free is 6. And I've seen that. So this is where clinically you can't just look at one number and isolate it.
That's
you
right.
have to look at the family. And in men's health, that's the other thing. And I know that we're running low on time, and there's so much to talk about here. And we
should
can
do
do more
another part.
podcasts on this.
I like that.
The most important thing is having a man understand that he does have more than testosterone. We didn't even talk about cortisol, and we didn't talk about thyroid hormone.
Yeah.
Those are a triad. So if your sex hormones are a mess, you have to check adrenals, you have to check thyroid, because the sex hormones could be a mess because one of the other is off, or vice versa. So those are important hormones that need to be checked in every man.
I want to ask you one more time. I want to ask you before we end up here. Sex hormone binding globulin, SHBG, is a test. You want it on the high end, you want it above 50, or you want it below 50?
I would say you probably want it below 50, but you don't want it too low.
No, but my understanding is that it is almost like an Uber driver that takes you to where you need to go. And if you are around 50 or a little below 50 to 60, that means that it's filling up and it's taking it to the source and it's coming back to pick up more. Where if it goes over 70 or 80, you actually have an Uber driver who says, well, I really like to have a full car first. So I'm waiting for more hormones to show up.
Yeah, and sex hormone binding globulin does not readily get rid. It doesn't give it up. It's like getting in a cab and there's no door handles. You can't get out.
Oh, that's not good.
Okay?
Yeah.
You're stuck.
I've seen those movies.
Yeah. You're stuck. So, like, you want to have less, so you don't have too low, but you want to have less.
Yeah.
Because the more you have, it doesn't matter what your total is, you're going to be binding it up.
Yeah.
And the other thing with men is, like, I can't discount enough how much stress men are under. We talk so much in this culture right now about toxic masculinity and like men are misogynist. Like men are different than women. Their brains work differently. They have skills and talents, things that rightly so are very different than women. They do a lot of the jobs and a lot of the things women do not want to do. Now that's changing in the world, but still typically men are in the military more, they do construction more, they do hard, heavy labor more. They have high stress jobs, and they still feel and they find value in being needed, respected, and providing. That's part of the male hormone system. We didn't even talk about prolactin. We haven't talked about oxytocin.
Well, we need to talk about another show.
Yeah. So these things are really important for men. And men are under a ton of stress. And when men feel like they're disrespected and they don't have any value in their life to the people around them or to their community, they suffer with mental health challenges.
Yeah.
And men are at higher risk of suicide. They're at higher risk of depression. They're at higher risk of high-risk activities that could cause them or others death. And they're at higher risk of addiction. And we need to, as a society, realize that taking one sex and turning it against the other, that's not what we're trying to do. We each have our own good skills. And in men's health, I've really realized men just need somebody to talk to who they trust. And a lot of times they don't even need testosterone. They need to deal with their stress, and they need somebody who they can trust and who shows them some respect. And in a lot of cases, you can do so much with men in helping them feel confident and secure and needed in what they're doing in life. And that's a huge thing. I think as we see these chemicals and everything else coming in affecting men's hormones at the same time, we're seeing so much mental and emotional garbage that's telling our society that men don't have value.
Right.
And I think we need to be very careful about that. Just like we wouldn't want to tell a woman that. Like men are, they can decompartmentalize, they can do what they need to do, but they suffer a lot from these things that are kind of under the surface, and they don't know where to go for help because they don't trust readily. Doctors don't listen to them readily. They're supposed to be tough. They're programmed young not to get help for these things. And we need to be having safe places for these men to get good health care. And whether they need the testosterone or they need it, most men also just need a doctor who's going to listen to them and not judge them. That's a big thing. So
I think it is very well said.
Yeah.
And I would like you to come back and expand on that. And like you said, talk about some of the other hormones, the prolactin and also the cortisol and adrenaline. Super interesting topic. But thank you so much for being here.
You're welcome.
Awesome.
Thank you.
Fantastic. Folks, thanks so much for listening. That was a lot of information here. I hope you took some notes or go back and listen to it again, take some notes, because this is a very, very interesting topic that needs to be further explored and discussed. And so hopefully you tune in for another session of Health in Focus. And thanks for listening today. Bye-bye.
Visit healthinfocusnow.com.